Now, let's talk about lobular carcinoma in situ. Once again, in situ, it means it is non-invasive tumor cells. They are going to be inside the lobules. Tumor cells inside the lobules without invading basement membrane. These tumor cells, as they are present, they are limited inside the lobules. They are not going to form any mess or calcifications. So if they are not going to form any mess or any calcification, how you are going to diagnose it? Well, if a female comes to a clinic, she is coming to do biopsy for some other reason of her chest, right? So it is discovered incidentally. Lobular carcinoma in situ, it is discovered incidentally. For some other condition. Tumor cells which are present in lobular carcinoma, they lack E-cadherin. And what is E-cadherin? E-cadherin is a adhesion protein. E-cadherin, it is a adhesion protein that is responsible for the cohesion between cells. So tumor cells, they lack E-cadherin. They lack E-cadherin. So tumor cells, they are also called discohesive cells. Means they are separate from each other. They do not form ducts as seen in ductal carcinoma in situ. What is the treatment of lobular carcinoma in situ? Well, the treatment for ductal carcinoma in situ is tamoxifen. Tamoxifen is the treatment of lobular carcinoma in situ. Now, the invasive type of lobular carcinoma, that is invasive lobular carcinoma. Tumor cells, they invade the basement membrane. They invade the basement membrane and they are infiltrating the stromal cells as single file pattern. Means if this is a lobule, right? Multiple lobules we talked about. These are the tumor cells. And they are invading the basement membrane. So they will be present as single file pattern. in stromal tissue. So the tumor cells, they will be present as single file pattern in the stromal cells. Remember that they also don't form ducts because of lack of E cadherin. Now let's move forward towards the prognostic and predictive factors prognosis of breast cancer is done by T and M staging. What is T and M staging? T and M staging is tumor size, number of nodes involved, and metastasis. So the prognosis of breast cancer is done by T and M staging. Although metastasis is the most important prognostic factor, but females, they present before metastasis. How you are going to diagnose breast cancer before metastasis? Well, you are going to take the axillary lymph nodes. You are going to take axillary lymph nodes and you will do the biopsy. In earlier times, when we used to diagnose the breast cancer, we used to take the lymph nodes. We used to take the lymph nodes, all the axillary lymph nodes. We used to take out all the axillary lymph nodes so that breast cancer does not metastasize, right? But what was the drawback? The drawback was that when we used to take out all the axillary lymph nodes, then there was edema of that side of the arm. Now what we do is we take the sentinel lymph nodes. We only take the sentinel lymph nodes for biopsy. What are sentinel lymph nodes? Sentinel lymph nodes are the first line axillary lymph nodes. First line axillary lymph nodes, if they are positive for breast cancer, then you are going to remove all axillary lymph nodes. But if sentinel lymph nodes are negative, then you're not going to take out the other axillary lymph nodes. It means if the first line lymph nodes are not involved in the breast cancer, then the axillary lymph nodes that are behind those sentinel lymph nodes, they are also not exposed to the breast cancer. So you're not going to take them out unnecessary, right? So like this, you can prevent the patient from developing edema. Now let's move forward towards the predictive factors. What are the predictive factors? Predictive factors are those factors that predict the response of treatment. Predictive factors include estrogen receptors, and progesterone receptors, and HER2 new receptor, HER2 new receptor. If there are many receptors of estrogen and progesterone, then you can give tamoxifen. It means that breast cancer has good prognosis. You can treat it with tamoxifen. If HER2 new receptors they are amplified, then you can use trastuzumab, an antibody for HER2 new receptors. It also has good prognosis. But if no estrogen receptors and no HER2 new receptors, which means triple negative tumors, which means no estrogen receptors, no progesterone receptors, and no HER2 new receptors, then these type of patients they cannot be treated with tamoxifen, which was for estrogen receptors, and trastuzumab, which was an antibody for HER2 new receptors. This type of tumors they have poor prognosis, and this type of cancers they are mostly seen in African American women. Now let's talk about hereditary breast cancer. In hereditary breast cancer, only 10% of the females they develop hereditary breast cancer. The risk factors are first degree relatives, or tumor at an early age. means premenopausal females. Because we saw that breast cancer is most commonly seen in postmenopausal females. So if you see any kind of tumor in premenopausal females, then it is a type of hereditary breast cancer. And hereditary breast cancer can be due to BRCA1 gene mutation, which can lead to breast and ovarian cancer. And if there is BRCA2 gene mutation, then there can be breast cancer in males. If a female finds out that she has BRCA1 gene mutation, then she can go for mastectomy. Bilateral mastectomy to prevent the development of breast cancer in future. But still, there are small chances of developing breast cancer, because breast tissue is not just limited to the chest region. It can also be there it can also penetrate into the muscles, right? So there's still little chance of developing breast cancer. Now let's talk about male breast cancer. As we saw earlier, that it is rare. If 99 female are developing breast cancer, then only one male is going to suffer from breast cancer. It can be due to BRCA2 gene mutation, or if a male is a Klinefelter, has Klinefelter syndrome. What type of breast cancer is most commonly seen in males is invasive ductal carcinoma. Invasive ductal carcinoma is the most common type of carcinoma that is seen in male, because males, they lack lobules. So you're not going to see invasive lobular carcinoma in males, right? So, and where in breast tissue you're going to see breast cancer, in which region of breast you're going to see breast cancer in males, that is beneath the nipple. Beneath the nipple, you're going to see the breast cancer, because there is where the breast density is more. Whereas in females, you're going to see breast density more in upper outer quadrant. So this was all about breast cancer pathology. Hope you enjoyed it. Please like and subscribe. Meet you in another interesting video. Thank you.